Thank you for joining me today. I'm Dr. Prudence Hall, and I'm going to be talking to you about the thyroid gland. Many women don't know that in menopause, which is age 44 to about 48, maybe 49, much earlier than our mothers were going into menopause at, that it's not just the ovarian gland that declines. It's also the thyroid gland. Now, the thyroid gland is right here in our neck, and it runs our metabolism. It gives us energy and vitality. It's one of the body's natural antidepressant hormones. So this little guy is important. The symptoms of low thyroid, which is very, very common in menopausal women, is fatigue, weight gain, as much as 20 or 30 pounds, hair loss, hair that becomes dry or brittle, skin that becomes dry, cracking heels. So the skin dries out and we feel kind of like an orange that's sat on the counter for too long. We also get constipated, and that has to do with the fact that thyroid keeps the bowel function very healthy. A lot of women tell me that their brain is foggy. The fatigue is enormous when we're experiencing a low thyroid, and we call that hypothyroid condition. And I deal with this every single day with my patients. So I'm going to teach you a little bit about some of the things you might not know about this very, very important gland. 40% of thyroid disease is not diagnosed by your doctor or your endocrinologist. And that's because doctors and endocrinologists follow very strict criteria for what is low thyroid. And low thyroid would be, for an endocrinologist or a doctor, having a high TSH. Now, the TSH is the thyroid stimulating hormone, and it's one of those hormones that the pituitary gland releases to get more of the thyroid hormone or to get less of it. So in the United States, if that TSH is above 4.4, that could indicate that the woman has low thyroid disease. But in Europe and in other countries, that level for the TSH has decreased, and it's settling someplace between 1 and 2 or less than 2 as a more ideal level. So if we only look at the TSH, which is what many, many doctors do, they're going to miss a classic hypothyroid, low thyroid condition. I always look at the T3, and it's a free hormone because there are two thyroid hormones. One is T4 and one is T3. And when we measure those in the most accurate way, and we call that a free T3 and free T4 level, then we're able to see more precisely what the thyroid is doing. When we look only at the TSH, that'll tell us a lot about the pituitary gland. And as we age, many of our pituitary glands don't function as well. So we might be seeing a lower pituitary gland or a pituitary gland that can't respond to a low hormone and not really what that gland is doing. So the T3, the free T3, is extremely important. It should be 3.1 to 3.2 or greater. Now that number is the minimal amount it should be at. And these levels have been verified and really established by Terry Hertog. Dr. Hertog was one of the greatest endocrinologists alive out of Belgium, and absolutely the wonderful, fantastic Dr. Dale Bredesen, who does tons of research in Alzheimer's disease. And I certainly agree with those levels, that you want that T3, that free T3, greater than 3.1 to 3.2. Now, where do I see it at? 2.2, 2.5, 2.6. Sometimes I'll see it very low at 1.9. So when I'm evaluating the thyroid, I do look at the TSH, but I use a much lower reference range than many people in the United States. I also look at that free T3, which is the most potent hormone that your thyroid is making. It's 6 times more potent than thyroxine, which is T4 that the thyroid makes. So I measure those levels. I also look at a reverse T3. And a reverse T3 is a thyroid hormone that's bound up, so it's less usable. It's going to affect the body less. You need the hormones to be in the free, active, available state for them to really work effectively. So when that reverse T3 is higher, that can indicate that even though your T3 could be at 3.1, 3.2, 3.5, even better 3.5, that it's not as active as the free T3. So we look at a number of blood levels. I also use the Meridian Valley urine test. And this was established by Jonathan Wright, who's a wonderful naturopathic doctor. I know him, and he's absolutely brilliant. And you collect your urine for 24 hours. And I like to correlate that 24-hour Meridian Valley urine test with the thyroid, with the blood test. And I start to do that when women will have a TSH that's low, and their TSH is like, for example, 0.1 or 0.2 or 0.09. Like they have all the symptoms of hypothyroidism. So it's like, wait, the blood test is not correlating to the symptoms that women have. Now, the symptoms are very important, and I actually give women, and I can put this online for you to check your own thyroid. We'll put that in the notes below, the thyroid questionnaire that I give people. When you score more than 10 points on this questionnaire, it can mean quite probably that you have low thyroid conditions. So when the TSH doesn't seem to be reflecting really how you're feeling, I'll go to that urine test, and it clears it up so many times. I'm thinking of even a patient that I saw today with Alexandra, and we've been struggling with this very low TSH for quite a long time, and I kept saying, well, maybe we should just lower that thyroid a little bit, because her T3 was 3.1, which was adequate, but that TSH was showing that it was too much thyroid. Well, when I looked at her Meridian Valley, I saw that her T3 and T4 in that 24-hour urine test was way off the scale in terms of not having enough. She wasn't even any place on that scale of normal. So at that point, I said, okay, your TSH value is not accurate, but the Meridian Valley is. So we're going to go by symptoms and the Meridian Valley for that test. So see, the thyroid, analyzing and diagnosing the thyroid is actually pretty complex. And you really want to start with the symptoms you have. So if you have any of those symptoms, fatigue, weight gain, dry hair, dry skin, constipation, foggy brains, depression, then you should definitely have your thyroid checked. And you can recommend some of the testing that I do routinely with my patients. And I think that there will be a very good chance that you do have low thyroid. Now, how do we treat this? So the first thing I do is I always use a T3 and a T4 combination. So those are the true thyroid hormones. And one of the problems with using the traditional Synthroid or levothyroxine is that they are a pure T4. T4 needs to break down into T3 in order to really have the effect that we are looking for. And like I said, T3 is 6 times more potent than T4. So we don't want that thyroid to stay only in the T4 form. And I see this a lot. So that's why when I replace thyroid hormones using the same exact hormone that your body is making, I replace it with T4 and T3. Now, once I change the thyroid gland, I like to kind of go deeper and say, well, why is your thyroid gland deficient? I mean, what has caused this? And I think a lot of doctors don't look at the core root cause of why the thyroid gland is low. And I've done a lot of thinking about this and research on this, and it can come down to gluten. Gluten, that's one factor, it's not the only thing, but gluten tends to cause thyroid conditions like a thyroid autoimmunity called Hashimoto's. So if anyone has antibodies to their thyroid gland, meaning that they're starting to reject their thyroid gland, and this is what happens with autoimmunity. We can start rejecting parts of our body. Then I take that person off of gluten. And when people just don't have Hashimoto's and just have normal low thyroid conditions, I also like to suggest an anti-inflammatory diet, which means removing as much as possible gluten, corn, soy, dairy for many people, nightshades for other people. And that'll help the thyroid gland to regain its health. Also, low thyroid can be caused due to low iodine. Now, iodine's a mineral, and lots has been written about it. The Japanese seem to have quite a bit less thyroid disease than we have in the West. And people are saying, and I do agree with this, that iodine that the Japanese take because they eat lots of seaweed and lots of sea plants and things like that, is one of the reasons why they have less thyroid disease. So I give my patients who have low thyroid, and especially low T3, I give them iodine, because iodine helps to break the T4 down into the T3, which is the most active hormone. So how much iodine do you take? Well, you can take about any place between 1 to 10 milligrams. 10 milligrams, 12 milligrams is at the very higher end, 1 milligram is at the lower end. So I usually say about 5 milligrams of iodine. If you itch when you have iodine, you're one of the few people that's allergic to iodine, so you wouldn't be able to use that therapy. And another reason why the thyroid gland doesn't work as well as it should is that we don't have enough selenium. Selenium is very important in terms of creating thyroid hormone. Also, an omega-3 deficiency can be a problem with thyroid. So I try to get my women on very pure omega-3, and I like the Pure Alaskan omega-3 oil, wild salmon oil that is sold at Costco. It's inexpensive and it's super pure. It's what I take. So those 3 supplements, the iodine, selenium, and the fish oil, are very, very helpful in terms of additions. And then what we take away is we take away gluten and inflammatory foods that might be very specific to what causes the inflammation with you. Once I correct the thyroid gland back to normal, I want to see a response in symptoms. So I want to hear my patients say, I have so much more energy, Prudence. Oh, my hair is suddenly growing. I'm not losing handfuls of hair, hairbrushes of hair. Yes, my skin is better. Do you see it's more moist? My heels are not cracking. And I just feel such joy when women say, I'm not depressed. I mean, I feel good. I feel really, really good. And I don't know, it was kind of like that dark cloud just lifted for me. And it's just like, okay, bingo, symptoms are gone. You feel great. The numbers are correct in terms of analyzing them. Now, one of the times in a woman's life when she might very well have increased low thyroid conditions is after the birth of a baby. And when women have a child and they're postpartum, I monitor them quite closely to make sure that they're not going into the decline of postpartum depression. And postpartum depression is quite common. And the main reason for that is that your estradiol levels are in the thousands and they fall to like 5 to 10. So this rapid fall in estrogen absolutely can contribute to postpartum depression. It's easy to fix. I fix it all the time. But let's put that aside. The second reason why women go into postpartum depression, can't lose their weight, feel so exhausted they can't get out of bed, are getting depressed and weirded out, and yes, hair falls after you've had a baby, but not as much as when your thyroid is low. And the reason why the thyroid becomes low after the birth of one baby, and especially after the birth of a second child, is that the children will take your iodine, take your selenium, and a lot of the other nutrients that help to build the thyroid. So we really become physiologically depleted in terms of our minerals, our omega-3, our iodine after the birth of a baby. So I think that these are excellent supplements to take during pregnancy, of course, in low levels and physiologic levels. So if you feel that you are getting depressed or more tired or just can't lose your baby weight, please have your doctor look at your thyroid hormone and really do a deep dive on that. So this is just a little bit of information about your thyroid gland. Remember that 40% of women will go to their doctor and their doctor will say everything is fine. And I assure you, in 40% of the cases, it is not okay. They just haven't done enough of the testing. So if you're interested in this, I'm going to do a deep dive with all of my women's groups that I lead. They're online classes with 15 women. And we have a great time. We analyze all the hormones, reboot everything back to youthful levels, and it's a great way to help manage your hormones. So lovely talking to you today. Thank you for joining.